get ready in case I need another one of these.
Hi, everybody. My name is Madison Elliott. I am a substance use specialist / social worker for Talbot County Public Schools. I have here with me today Beth Williams.
Morning.
I'll let her introduce herself. And we're going to be talking about, updating about marijuana, talk a little bit about the legalization of next year, but, still talking about the reasons why, marijuana is bad for you, and why, just trying to keep our kids safe here and why, they shouldn't be smoking. But we are going to be talking about the medical side of it as well. I'm also going to put my contact information in early so I don't forget at the end. So you guys can email me or Beth any questions you have if you think of it afterwards, but we will be doing Q&A at the end. And I'm gonna put this in the chat here, my email. I'll have her put hers in. Do it for you.
You can put mine in too if you want to.
Yeah, I was gonna say, do you want to type yours on?
Good morning. Good morning, everyone. My name is Beth Williams. I'm a substance abuse prevention specialist. I'm going to put my email in here as well. So if you have questions or if you'd like maybe copies of the materials, you can shoot me an email. Also, I'll tell you a little bit about the program that I'm doing some consulting with. Indeed, there we go.
Is that your new one?
That's my work one, yeah. So we're going to talk a little bit today, as Madison introduced, about marijuana and kind of update a little bit about the presentation we did a while ago with parents, but there's a lot of new information out there and a lot of questions. So we're going to go ahead and get started. And if you have any questions, you can go ahead and put them in the chat. We'll try to get them answered. Either, we can either email you or we can, answer them during the session. And is the session being recorded?
Yeah.
And the session will be recorded, so you can refer back to it.
Yeah, it is.
Okay. So we'll get started. When am I pushing this one?
Yeah, let me share
Oh,
my
okay.
screen.
Oh,
real quick.
that's right.
I was
Okay.
waiting for you to. We'll just let me close this out. And I
Okay.
have to do it up here first, and I have to do it.
Okay. I am previously from the health department, and I'm now working with the University of Maryland Extension on what we call the ROPTA project, which stands for Reinforcing Overdose Prevention Through Training and Advocacy. And I'll talk to you a little bit more afterwards about that. Okay. So here we go. Where am I pushing this? Here we go. So what we'll cover today looks like a lot of information, and it may feel like a little bit of information to take in all at once. But again, some of this may be reviewed to those of you that have been following along with these webinars. And again, if you have questions or, comments about things, we'll gladly take those at the end. We're going to look at what the scope of the problem is right now in our country with marijuana, some facts and maybe dispelling some myths, THC and CBD, signs of marijuana use, effects on the body, specifically the heart, lungs, brain, and mental health, combinations, so things that marijuana may be like laced with that we need to be aware of, concentrates and edibles, cannabis use disorder, which is considered a psychiatric disorder, medical use, legalization information, which is kind of hot off the press, and just some general prevention tips, since we always like to leave with some good information and things for parents to think about that they can do to help their kids. So as of the Monitoring the Future study, which has been a study that's gone on since 1975, it's a longitudinal study. They get reports every year. More than 1 in 10 young adults reported using marijuana on a daily basis in 21, and more than 2 in 5 used it in the past year. Rates of marijuana use nearly doubled over the past 10 years for this age group, and past year use jumped nearly 50%. Now, we know that the pandemic was in there. A lot of people were dealing with a lot of other issues going on during the pandemic. The pandemic really kind of exacerbated the addiction problem that we've already had in our country. So it's not surprising to see these kind of increases. About 16% of young adults reported vaping nicotine in the past month, and 12% report vaping marijuana. Infants, children, and teens, why these are important, and this data is important when we look at young adults, is that infants, children, and teens who still have developing brains are especially susceptible to the adverse effects of marijuana, and that's whether they're around somebody that's smoking it or obviously if they're using it. Marijuana is a mind-altering psychoactive drug produced by cannabis sativa plant, contains over 500 substances or chemicals, and over 100 of those chemicals or compounds in marijuana are psychoactive compounds, and that's what produces the psychoactive or high effect, particularly THC. Marijuana has a psychedelic, hallucinogen, and depressive effects. It's not labeled as one specific drug, but as a combination because of the effects that it produces. It can be smoked as a cigarette, which is commonly called a joint or a roach, in a pipe, bong, or a blunt, which is a hollowed out cigar. It can affect driving, and it is not safer to drive under the influence of marijuana than it is with alcohol. There is a myth out there that says marijuana makes people calmer, so they drive better, and that has not been proven out in research. It is addictive, and we'll talk a little bit more of that. Cannabis use disorder, like I mentioned earlier, is a diagnosable disorder. Marijuana can cause tolerance, withdrawal, and overdose, and it is a gateway drug. Okay, so this slide is telling us that adolescent use of any of these substances do make them considered to be gateway drugs into future use of heroin or fentanyl. You might need to take over in a second. So for instance, adolescent use of marijuana makes future use of heroin or fentanyl 3 times more likely.
Excuse me. So on the slide here, just a little bit about what the plant marijuana looks like, and then how it looks like in what you call over here to the right, a blunt or wrap. So on the left here, this is, a marijuana. These are called buds. And then in the middle here, this is a bong, and these are different variations of what a bong looks like. And then you place the marijuana bud in, you can't see me pointing, in the middle here where it's opened, and you kind of light it with a lighter, and that's how kids are smoking it. These are different kinds of vapes and pipes. You can actually smoke marijuana in a vape and a pipe if you didn't know that already. And there's also pods now with the vapes that kids are accessing, but you can tell if it's a regular vaping pod or a marijuana pod, because at the bottom of the marijuana pod, it says THC. So they're all, as far as I know, they're all labeled THC. And that's how you know if your child is just vaping regular or marijuana. But these are kind of different variations of vapes. There's Juul. There's like a lot of popular, the Views. Views is one of them. What I mainly see are Views and Juul's vapes being used. Some slang names with marijuana. I'm sure you've heard a bunch of common ones, like Mary Jane, bud, blunts, dope. What else is there? Reefer, smoke, weed is, I think, the most common one. Joint, herb, grass. Some not common ones, at least I haven't heard, like keef, yerba, hash, gangster, skunk. I haven't heard of skunk before. But those are just some, like, and you can, look out, like, with your child's phone, if you see any of these names, that's probably what they're referring to. Pot's another good one. That kids use what they call weed. Did you want to take back over?
I'll try again. Sorry about that. I'm fighting off the end results of a cold here, so so hopefully I'll get through the rest of this for you. THC is the primary mind-altering chemical in marijuana. That stands for delta-9 tetrahydrocannabinol, found in the buds of the plant. It's what produces the high. When smoked, it rapidly passes from the lungs to the bloodstream and then carried throughout the body. If eaten, THC, it's absorbed more slowly, so the effects are felt in maybe 30 to 60 minutes. And as we talk about edibles later, we'll see that this is what causes overdose from edibles, as people get impatient waiting for that high to kick in. Okay, CBD, this is something new that we've added since we're hearing so much about CBD. It is one single compound found in and extracted from the cannabis plant. So while marijuana is a type of the plant that contains many compounds, CBD and THC are some of those compounds. I think it's over 500 compounds are found in marijuana. The FDA has approved only one CBD product, which is a prescription drug product to treat seizures associated with specific conditions. That is to say then that the FDA has not approved any other CBD over-the-counter product. It is currently illegal to market CBD by adding it to a food or labeling it as a dietary supplement. CBD products can legally only contain up to 0.3% of THC. There's no way to completely split THC out of CBD, but THC in these very, very small doses can, when combined with CBD, can seem to be effective in some cases. But again, these products are not FDA approved. Products include gummies, oil, capsules, and tinctures that you would, tincture is something you would drink or take orally. Now, this was interesting when I researched this. There are only 6 evidence-based proven health effects of CBD. And in research, these did not bear out all of the time. So they may relieve pain, mostly in the research with multiple sclerosis and arthritis patients. They found it was somewhat effective. There are neurotransmitters in our brain, that'll sound a little familiar to you from previous presentations, that interact with the cannabinoid receptors in our brain, or cannabis receptors in our brain. The neurotransmitter interacts with that receptor and eases pain. The CBD could reduce symptoms of mental health disorders. Particularly, they've had some studies that have looked promising for anxiety and PTSD. They may alleviate certain cancer-related symptoms, pain, or possibly nausea, but the study results have been mixed. They may have neuroprotective properties. So that means that there were some positive results with the relaxing of people that are having seizures, the seizing up, the spastic nature, the tightening, but there were still some adverse effects found in those studies. May benefit heart health, which is interesting, possibly artery function and blood pressure. And other benefits are limited, and including relief from people that have a certain specific brain tumor, antipsychotic properties, people that are having psychotic mental health challenges, and sleep benefits. But again, it is not without its side effects. Can cause changes in appetite and weight, diarrhea and fatigue. Possible other effects may include drowsiness, sedation, possible respiratory concerns, and possible liver damage. And it interacts with other medications, including those that treat pain, depression, diabetes, and seizures. So as with anything new, talk to your doctor if you are even considering using CBD, because it may interact, or we cannot rule out these side effects. So there are ongoing questions about it, just like any product over the counter that is not regulated in any way. There are variations in dose. You're not going to know really how much will help you versus how much is doing too much. The quality of the product, as we know, you can see these online, you see them through mail order, you can get them in a pharmacy, you can get them in a 7-Eleven. We don't really know which of those products are more quality products, while others may have other things mixed in to dilute them down or whatever. And that goes along with the purity of the product. And again, it may contain other blends or other herbal products. Many herbal products or herbal supplements will interfere with medications. So again, if you're on an herbal supplement, your physician needs to know that, because that can also interact with medication. And the presence or the absence or the level of how much THC might be in that CBD oil can affect the results as well. And again, legally, it cannot be any more than 0.3%. And again, there's just no guarantee of a consistency or safety due to not having any oversight by the FDA. Okay, so marijuana of today is not like the marijuana of the 70s. We always say not like our grandparents' marijuana or our parents' marijuana. In the 70s, the THC levels, again, that's the chemical that gives you the high feeling, the euphoric feeling, psychoactive. It was 3.7% was about the average in the 70s. Now the average marijuana levels for THC are about 15%. Now, what we're seeing in some of the extracts or the edibles that are out there, extracts, and we'll talk about those in a bit, are used in vaping, dabbing, and edibles can contain 50% or up. And we've even seen some that have been sold that are up to 90% THC, which is a staggering amount of THC. And of course, we know that with higher THC levels mean a greater risk for risky behaviors and addiction. Okay, so in general, and you all have probably seen this slide before, but when we talk about signs of marijuana use, we're talking generally in signs of most substance abuse. It can be easy to dismiss changes as normal adolescent behavior. We all know when our kids get to be about 11 or 12, they start doing things that we just have never seen them do before, or speak in ways we've never heard. So that can, of course, be part of normal adolescent development, but we also want to look for changes that seem to be occurring frequently in patterns, extremes over time, and that just seem just very unusual or not normal for your child, even given those other factors. So physical signs of marijuana or cannabis use, red eyes, maybe they're using eye drops more often, dilated pupils, a dry cough, dry mouth, changes in appetite. They may get what we call the munchies, where they want to eat everything in sight, or they may get nausea and loss of appetite. Again, marijuana does have depressant qualities, so it can make people, feel sick or feel nauseated. Dizziness, facial flushing, slowed motor speed or slowed speech, impaired coordination or clumsiness. Other things you may see are changes in mood, personality, or outlook. You may see something that ranges from a really high, a euphoric, a silly mood, laughing, feeling very talkative, or you may see it ranging, especially as they're coming down off the high, to depression, sleeping, and lethargy. Disinhibition, relaxation, again, real talkative, real social, using drug-friendly speech or attitude, whereas we try to talk to our kids about certain substances are not healthy for them or not safe, they may kind of try to defend it a little bit, or, oh, well, it's nothing wrong with it. I know people that do it and it's fine, or, anything that seems to be that their attitude is going toward this not being harmful. Impaired judgment, like impaired driving, increases in risk-taking behavior. Sometimes you might even see like an exaggerated sense of creativity or feeling like they're just smarter when they use marijuana. A couple more signs, problems with family, lack of motivation. We used to call this amotivational syndrome, where people specifically that use a lot of marijuana just are, they're like lumps. They just don't feel like doing anything. They can't get motivated. They can't get moving. They're just kind of, I guess you could say, lazy in a way, just very down, very kind of not really caring to do anything. Social or behavioral problems, might be delinquent behaviors, trouble with the law, school or work problems, Because marijuana affects the attention span and the areas of the brain that have to do with memory, of course, it's going to affect their skills and how well they can learn and absorb new information. So you may see your child spending less time studying, skipping classes, skipping school, lowered grades, or dropping out of school. And I think in the last the last presentation we did on fentanyl, we talked also about a new peer group and maybe being hesitant to introduce their family to their new peer group, or hanging around with people that you don't know. Longer term effects could be sedation, just feeling very, lack of energy, very sleepy, very tired. Changes in appetite, we talked about that, and the bloodshot eyes and the sleep. But breathing problems and lung diseases, and we'll talk more specifically about that. When someone uses marijuana, there is an increase in heart rate or tachycardia, which is like a racing of the heart that could last up to 3 hours, and an increase in blood pressure. And for some people, they found in studies, there's almost 5% increased risk of heart attack in the first hour. Now, of course, this is going to also be affected by if the marijuana is cut with something or something's been added to it. And we'll talk about that in a second. Affects fetal development. It can increase, I don't know what's there because we got a thing going. It can increase low birth weight incidence. And also just in general, poor health for the mother can translate into the infant and maybe not getting enough nutrition or oxygen. Increased risk of cancers, tumors, tumors in various areas of the body. Marijuana and THC seem to accumulate in the fattier areas in our body fat. And believe it or not, areas like our brain have a lot of fat in there. Sounds kind of funny, but those areas that have more body fat tend to hold on to that THC for a longer time. Okay. So just specifically with longer term use of marijuana, cardiovascular health is affected. It could lead to increased risk of stroke, heart disease, or other vascular diseases. This is largely linked to marijuana and strokes and heart attacks, largely linked to people who smoked marijuana as opposed to took it in other forms. Sometimes people eat it, as we see in edibles. But this would specifically be people who smoked, because it's not just the chemicals in the marijuana, but it's just that action of smoking that gets into your lungs and into your bloodstream. Marijuana smoke delivers many of the same substances in tobacco smoke that are harmful both to the lungs and cardiovascular. So it's very hard to separate the effects of marijuana chemicals versus the effects of the heavy smoke, because unlike with cigarettes, there are no filters when you're smoking marijuana. It's burns very hot, and that hot smoke gets immediately down into your lungs. It can harm lung tissues and cause scarring and damage to smaller blood vessels around the lungs. Again, this is, I probably could have combined these slides now that I'm looking at it again. Has the same toxins and irritants and carcinogens as tobacco smoke, and leads to a greater risk of bronchitis, cough, and mucus production. And you will see that often with people who are marijuana smokers, as well as a really frequent cough, often a dry cough. And then effects on the brain and mental health. It connects to specific sites in the brain that affect or influence our sensations of pleasure, memory, thought, concentration, sensory and time perception, coordination, and able to communicate. It causes decreased blood flow to the brain. Again, these depressant effects are in play. A poor ability to plan, unpleasant thoughts or feelings of anxiety and paranoia, hallucinations, which do occur with marijuana. It does have psychological psychoactive or psychedelic properties. I'm sorry. So people do get hallucinations and may get panic attacks as well. Even though people, the kind of the myth that's out there is people feel marijuana calms them down. It makes them really mellow, and it can do that, but it also has these, the chance of these other effects, which really can be frightening if people don't know or have not experienced before, like especially with panic attacks or psychosis, like hallucinations and paranoia. And impaired mental functioning into adulthood. If someone's been a heavy smoker through their adolescence, it could take a really, really, really long time for all of that to get out of their system. And what also happens is that from the time you smoke marijuana to the time you stop, and that's all out of your system, you are not learning new behaviors, or we're learning how to manage your life, learning life skills. I've known people in their 40s, I could specifically, many people I know now that smoked heavily in their youth have trouble still managing finances, writing bills, organizing things in their life. They just never gained those skills. So they have, instead of being really rehabilitated, they have to be habilitated. They have to learn those brand new. Marijuana use is linked with schizophrenia, particularly early onset. Usually people in their late teens, early 20s, and particularly if they have other risk factors for psychotic illnesses, they will have an earlier onset of that if they're using marijuana. So using it at an earlier age and using more frequently, produces a greater risk of developing schizophrenia, and has also been linked to depression, social anxiety, and thoughts of suicide, attempts and suicide. Okay, so this was something that Madison and I had never heard, the term fry, but we wanted to talk a little bit about things that marijuana can be combined with or, cut with, that are not, are making it more dangerous than it already is. So fry is a term for marijuana or tobacco cigarettes that are dipped in PCP or embalming fluid and then dried. So we are seeing a lot more PCP, which is a really awful street drug. And it is very frequently, cigarettes are dipped into it and then smoked. And some of the slang names for fry, you can see below: dippers, fry sticks, happy sticks, milk, purple rain, wet daddy, wet water, those kind of things. So drank. So fry would either be cigarettes or tobacco dipped in PCP or embalming fluid. Okay. So when we talk about PCP, just a really quick overview. It was developed in the 50s and as an intravenous anesthetic, but human use was discontinued very shortly after because patients became agitated, delusional, irrational, and violent. Today, people abuse PCP again, it's coming around again because of the mind-altering or hallucinogenic effects. Marijuana is sprayed or a joint is dipped into PCP. And you could technically also use PCP powder and kind of sprinkle or mix that in with marijuana, the loose marijuana. The thing about PCP that makes it very dangerous, it is an anesthetic, but it's also a hallucinogenic drug. So people are hallucinating and behaving in very odd or unsafe ways, but they don't have any sensation of pain. Makes it an extremely dangerous drug. And you could see some of the slang for PCP. If you were to hear some of these, you might want to look into that. Green or greens, trank, animal trank, crystal, dipper. Again, dipper you're going to hear a lot in any of these combinations. Greens is usually when it's sprinkled on marijuana. Joint, dust, those kind of things. Very dangerous. This is just a picture of PCP in the powder or chunky form on the left, the white powder, and in liquid form. And on the right is a cigarette that is being or has been dipped in liquid PCP. Okay. And believe it or not, embalming fluid, that's what they used in funeral homes. It's a compound that contains formaldehyde, methanol, or ethyl alcohol and other solvents. It's really awful. When it is when a marijuana joint is dipped or sprayed with embalming fluid, the embalming fluid produces a hallucinogenic effect, more so than just straight marijuana. And it causes the cigarette to burn more slowly. So there's a more prolonged high, which also means it's more smoke that goes into the lungs. I don't know why it says, oh, I don't know why that says marijuana there, but the joint is dipped or sprayed, and cigars can also be dipped in embalming fluid and are called Smurfs. Very often, cigars are used with marijuana. They will hollow out the tobacco from the cigar and pack it with marijuana, and that's called a blunt. Okay, and of course, fentanyl is in everything, and we know it is in marijuana. We know it's a synthetic fentanyl is a synthetic opioid sold usually as a powder illegally, but it can be liquefied and dropped onto blotter paper. And I gave you some examples over here of blotter paper. Typically you see LSD on this. It's just liquid that is stamped into these little squares, and people would like cut off one of these squares and put it on their tongue. But you can also do that with fentanyl. But when we're talking marijuana, it's typically put in either eyedroppers or nasal sprays, so it can be sprayed, in a spray form that it can be sprayed onto marijuana. Or, I guess with the liquid, you could also dip it into fentanyl as well, but I think mostly it's sprayed. And we know that 50 to 100 times more powerful than morphine, and fentanyl is 30 to 50 times more powerful than heroin. I don't know why that's in there. Okay, so fentanyl, there are some slang names, and you've probably heard these from our previous presentations. China girl, China white, friend, TNT. I've never heard some of these either. I've never heard murder aid or tango. And this is just, you've seen this picture before of the penny. A fatal dose of fentanyl is 2 to 3 milligrams. So you can see what a small amount of fentanyl that is. And if they are sprinkling it onto marijuana, that is really not that much fentanyl. That could cause a potentially very serious effect with somebody smoking marijuana. And this is just a HIDTA bulletin. HIDTA is the high intensity drug trafficking area funds that come from the federal government, and the Washington, Virginia, Maryland area receives those funds. So they monitor drugs that are being trafficked. And they have found fentanyl that has been laced in marijuana. And they had this particular case, the marijuana was sprayed with fentanyl. Okay, so marijuana concentrates and vaping. So concentrate, a highly potent and concentrated THC is what they call concentrates. Resembles honey or butter. I'll show you some pictures in a minute. Up to 4 times stronger than high grade or top shelf marijuana, which is usually, like we said, 15 to 20%, where some of these concentrates are up to 40 to 80%. Commonly used, as Madison stated, in vaping devices because they're smokeless, they're odorless, very easy to conceal. A small amount or a dab is heated in a vaping device, and that's called dabbing. Produces vapor, so it's not really burning it, but it's vaporizing it, and it gives a person an instant high. And the effects are more physically and psychologically intense than smoking marijuana. Street names, anything sounding like honey or butter. 710, which is oil that's flipped and spelled backwards because it looks like an oil or a butter. Wax, hash oil, shatter, dab, etc. So this is what the different concentrates may look like. Crumble, you can see it looks, it's just kind of waxy. It's maybe looks a little bit like dried honey. Some of them harden, like on the bottom, that look more like a brittle, solid kind of a thing. Rosin, dry sift, which is a finer, on the bottom right there, a finer, almost powdered leafy marijuana. Bubble hash, so they take the pulling out pieces and making it more condensed. This is just kind of something that you might see. If it looks waxy, if it looks like a glaze or a sticky liquid, that's probably a marijuana concentrate. Now to go a step further with that, we're talking about edibles, where concentrates are infused into food. So we've all heard about marijuana brownies back in the day. That was usually made with leafy marijuana, but now they use edibles again, because you really can't, it doesn't have an odor. It's hard to detect. It's a lot stronger. Also putting cookies or candy or maybe even into a beverage. It does take longer to digest. So people may consume more because they don't feel that immediate high that they usually feel with marijuana or vaping. Just some pictures from the DEA that will show you how these edibles are marketed. We will probably be seeing more of this in Maryland now that it's legal. That you'd be able to walk into a 7-Eleven and buy this. It's very dangerous, as we all know, that they make it look like candy, or cookies, so very recognizable to young people, and they may associate that with it not being harmful, or may mistake it for being a candy or a snack. Let's see some more of these examples. This, to me, is probably one of the most frightening things, because if a child isn't even in a home and they see these, they're going to think it's candy and, eat a whole piece. Where in places like Colorado, where these have been legal for a few years now, some of these packages, like the cookies, they'll tell you eat 1/8 of this cookie. Do not eat any more than 1/8 of a cookie. Well, if a child sees that cookie, they're not going to know to cut it into a small piece, and could end up overdosing on that. And you can see some of these liquids as well. Very dangerous. Gummies are very popular, and again, that's every kid's favorite food or favorite candy are gummies, and this is what we'll see, even to look like gummy bears. Okay, so we talked early in the presentation today about cannabis use disorder. The Diagnostic and Statistical Manual of Mental Disorders, which is called the DSM-5, is published by the American Psychiatric Association, provides criteria so people can diagnose and know how to treat mental disorders. And they do consider cannabis there to be a cannabis use disorder. So cannabis use disorder would be diagnosed if the person had a minimum of a year with at least 2 of the following symptoms, and accompanied by serious impairment of functioning and agitation. So some of these symptoms, you would need 2 of these to be diagnosed. Repeatedly trying to stop or lessen the amount used. Unusual amount of time spent trying to get, use, or recover from the effects. Having cravings for cannabis, such as thoughts and images, dreams about it, perceiving the smell, just being really obsessed with cannabis, how to get it, when can I get more. Continued use despite negative consequences. This might be personal life, relationships breaking up, poor job performances, job loss, poor performance in school, any of those things. Or it could be physical or psychological problems, such as the lack of motivation we talked about, the cough, respiratory, things like that. So continued use despite negative consequences, having cravings, using despite risk. And I'm going to go back to the other page. Repeatedly trying to stop, lack of control over how much they're using, and seeking the drug. Now, obviously, we've talked about addiction quite a lot in these webinars. These are all signs of addiction to any substance, whether it be alcohol or fentanyl. And cannabis is addictive. That's another myth that's gone around many years, that it is not an addictive drug, but it is in fact addictive. All right, risks for cannabis use disorder. We'll go through briefly. I know our time may be running down a little bit. Risk factors that are listed in the DSM-5 include a family history of any chemical dependence, history of conduct disorder or antisocial personality disorders. low socioeconomic status, history of tobacco use. We're talking about some of the ACEs things, abusive family, unpredictable family circumstances, family members who use or smoke cannabis, poor performance in school, easy to get it. We're talking access, just like with many of the other drugs. That's part of the risk factors that are involved, is how accessible it is to get that supply of drugs, and drug tolerant culture. And just to review, with cannabis use disorder, people do develop a tolerance to cannabis. You can overdose on cannabis, and we'll talk about that in a moment. But you may need larger amounts to get the psychoactive effect, to get that high that you used to be experiencing with one or two, with one or two puffs of a joint. Sometimes people will try to use cannabis to halt the symptoms of withdrawal from cannabis. That is certainly something that can be diagnosed under cannabis use disorder. And using it as a priority, and we've talked about the brain chemistry and how the brain reorders its priorities for survival based on the drug. So it becomes more important than any areas of life, than eating, drinking, all of those things, drinking water, etc. Okay, so something else I learned new was the term greening out. Greening out is also known as whiting out. It is where a cannabis user feels very sick after smoking cannabis and has a stronger or more unpleasant effect than usual, more likely to occur if the person is also drinking alcohol while smoking, because alcohol in the bloodstream can speed up the absorption of THC. Typically occurs with overconsumption, the person going over their tolerance level, and lasts a few minutes up to 2 hours. In other words, this is a cannabis overdose. And a lot of people, again, another myth is you can't overdose on pot. It's safe, it's natural, you can't overdose. But yes, you can overdose on pot, and it's called greening out. Some of the symptoms, the person, they're kind of green, nauseated or pale, ashy appearance, nausea and vomiting, dizziness, lightheadedness, losing mobile functions. Their arms or their legs feel really heavy, like they can't move. They might have decreased blood sugar, increased heart rate, blurry vision or trouble hearing. Again, the hallucinations may be mild. The hallucinations may even progress and get more frightening and more intense as time goes on. Unstable balance, and just an increased anxiety, uneasiness, paranoia, or panic attacks. And this is interesting because, again, we always are hearing that marijuana calms you down, it makes you mellow, it's just peace and love, and everybody's just very mellow when they smoke pot, but that is not the case often. Excuse me one moment. Do you want to do this a little bit? I'm just going to take a
Okay. So some of the dangers, like Beth was referring to last slide, of greening out. So both alcohol and cannabis have depressant effects when using. If combined, can increase the risk of the central nervous system, slowing down at dangerous levels. It could affect respiratory functioning as well. So, difficulty breathing, a lot of difficulty breathing.
I can do this part if you want.
Antiemetic effect.
Yeah. So cannabis in general, marijuana has what they call an antiemetic effect. That is why a lot of people that are on chemotherapy and can't hold food down use marijuana. And it can be prescribed for that by a physician. It helps people to regain an appetite and keeps them from vomiting or feeling sick. So that's why it's used. So it makes sense if you're drinking alcohol, and the brain also has, I'm not sure if we talked about this when we talked about the brain a couple sessions ago, but the brain has a part, the back part of your brain toward the brainstem has what we call a vomit reflex. And that is the body's way of protecting against alcohol poisoning. So when a person has consumed enough alcohol that they are, way up in blood alcohol levels, the brain will kick into this vomit reflex so the body can get rid of the alcohol, to get it out of its system so the person doesn't die of alcohol poisoning. So it kind of makes sense here that if you're smoking marijuana, which is preventing vomiting, but you're drinking enough alcohol along with marijuana that you're getting close to alcohol poisoning levels, that this can happen. This very sick, ill feeling can happen, and it can be dangerous. It gives the person a greater risk of succumbing to alcohol poisoning or aspirating or choking if they are able to vomit. Panic attacks also occur. Again, these can feel worse than they are, but they can be very frightening if you've never had a panic attack. People feel like they're going to die. They can't catch their breath. They're not in control. They're just, gasping for breath. They can't swallow. They're feeling like they're going to just, choke to death. They may be sweating. They may get a headache or backache, chest pains or palpitations. Okay. So that's greening out. Basically what that is a marijuana overdose. Okay, medical use of cannabis. There are 2 FDA-approved medications containing synthetic cannabis, which is called dronabinol. It's a synthetic pill form of THC. It is Schedule 3, which means it does have an accepted medical use. It does not have psychoactive effects, so the person will not get any kind of a high or euphoria off this medication. Typically, the brand names are Marinol or Syndros. This is used, the approved use from the FDA for AIDS-related wasting, anorexia, nausea, vomiting, chemotherapy-induced, can't hold food down kind of a thing, and post-traumatic stress disorder. But multiple studies have shown that the benefits of the marijuana plant, as people see it, are what does it say in there? The benefits of the marijuana plant, as opposed to the cannabinoids, do not outweigh the risk. In other words, there's no medically approved, FDA-approved use of the marijuana plant, because the risks of using the marijuana plant, especially to the lungs and the respiratory system, are too risky. They do not outweigh the benefits. There's no science to support medical use of crude marijuana, leaf marijuana that is smoked or ingested. Medical marijuana use cannot be prescribed under federal law. It can only be recommended. So yes, it's legal now. And that does cause a bit of a dilemma because it is not legal at the federal level. And it is not legal in every state. So federal law still states it is not legal for any use, medical or recreational. Marijuana is still classified as a Schedule I drug. As you may remember, a Schedule I is a high risk for abuse and no approved medical use. Same as heroin and cocaine. Has a high potential for abuse, has no currently accepted medical use, and there's a lack of accepted safety for use of the drug. These are just some organizations that have opposed legalization. The American Medical Society, Society of Addiction Medicine, American Cancer Society. There's another slide that has them. American Glaucoma Society, American Academy of Pediatrics, American Psychiatric Society, National MS Society, National Society of School Nurses, and I'm sure there are others. All are opposing the legalization of marijuana on a statewide as well as on a federal level. They do, however, support continued research, and there are many research studies going on how to improve and see if marijuana can be effective in some of those illnesses we talked about earlier. So with our recent election, state of Maryland has legalized marijuana beginning next July, the 1st of July, 2023. Smoking, possessing, and growing marijuana will be legal in Maryland for adults 21 and older. If you're younger than 21, you are not allowed to possess marijuana, even with the new law. Over 21, you can legally possess up to 1.5 ounces. More than 1.5 ounces, but less than 2.5 ounces will result in a civil fine of up to $250. Possession of more than 2.5 ounces could face up to 6 months in jail and a fine of up to $1,000. Adults only will be allowed to grow up to 2 plants at home, but it has to be out of public view. So I guess that means you can't have it in your front window or, anywhere else where people could see it. But we'll only be able to sell it with the proper license. Now, I put that in quotes because I'm not sure what that will be or how that licensing process will go. But we're early on, so I'm sure we'll find that out. But so that is what the legalization will be after July 1 next year. Okay, so what can parents do? Obviously, with any drug, we do not want our kids using anything that is harmful to them. And we want to try to postpone the first use of alcohol and tobacco because they are considered to be gateway drugs. We want to help them establish healthy behaviors, attitudes, and coping skills. A teen initiating alcohol use, for instance, is 4 times more likely to develop alcohol dependence as an adult. The younger you start using, the higher your risk is for developing dependence. Early tobacco use can be a gateway to other substance use, including marijuana. And I know that can be controversial. People don't like the term gateway drug, but when we're talking about young people, our kids, it is definitely a gateway drug to other drugs. And we saw in the earlier slide that use of marijuana makes you, I think it was 3 times more likely at some point in your life to progress onto opioid use. So what parents can do if you suspect your child is using any substance, marijuana or other, pay attention to those patterns of new behavior, unusual behavior, question or confront using a calm, factual, caring, and loving tone. Use your facts, use the observations that you've made, what you're noticing that gives you concern. Be informed, know available resources, and reach out when necessary for a reality check or to make a plan of action. So sometimes, there are hotlines out there. The CDC has hotlines, health departments have hotlines. There are many places you can call if you're in crisis, but you can also call just to ask these questions as a concerned parent or a concerned adult. This is what I'm observing. I can't believe my child would really be using a drug, but I just kind of want to know what to do with this information or these observations. And there are many people out there that can help you with that. Or to make a plan of action, what should I do now? How should I approach this? And as always, network with other parents. Our kids can, use one against the other. Oh, I'm going over to this person's house when really this person is going over to another person's house and you're all getting together and having a field party or something like that. So, it never hurts to communicate with parents, especially the parents of your kids' friends, and just kind of, make sure everybody's on the same page there. General prevention tips. I always love to give these at the end because it is never too early to start thinking about prevention. And we don't even have to mention the word drugs or alcohol. We can start by just doing some of these things, helping our kids develop the skills and the information, getting the information that they need. Those life skills are very important. So spending time together and maximizing the time that we have with our kids. If, we all have busy lives, and if we spend more time with our kids in the car, driving them to practice and home, there's time there that we can at least talk. It doesn't have to be big, heavy talk about, oh my gosh, drugs. It can be, how are you doing? How are you dealing with that stress about your exam coming up? Those kind of things. We can maximize those little snippets of time that we might have with our kids. Initiate the communication early. Praise and encourage positive choices, really accentuate all the positive things that they're doing in their lives that make you proud. Express concern about their safety and well-being on a regular basis. Express consistent messages regarding disapproval of substance use. Be really clear about your expectations of non-use and reminding them often, remember, you're not to be drinking when you go to that party, or you're not to be smoking pot when you're hanging out, after school. Establish alternatives and consequences and be prepared to enforce the consequences. It's the hardest thing that we have to do as parents, but it's crucial that we stick to our word about, we have a plan. We do not approve of this. When you stray from that, there are going to be consequences. Help them develop ways to resist and be comfortable saying no. Have some kind of an exit plan. So, if they're going to a party and they're not really sure that they really want to be there, or maybe they get there and they're feeling uncomfortable, there are situations they're not comfortable with, what's going to be the way for them to get out of it? Can they text you a word? Can they call you and say, Mom, can you come get me? I forgot I needed to do something tonight, or I'm not feeling well, or, have some kind of a way that they can get out of that while kind of trying to save face around their friends, if you will. Or give them ways to come up with a ready excuse for saying no, like, oh my gosh, my parents would kill me. Oh, my parents would freak out. I would be so in trouble if my parents found out I was here. So, we can practice that with them a little bit. Prevention research shows that eating meals together as often as possible can decrease youth and teen substance use by up to 50%. Very important, again, to have that time with our kids. Doesn't have to be real heavy, deep discussion time. It can just be something as simple as spending time together, enjoying time together, eating a meal together. And research has shown this throughout the years that eating meals together is one of those protective factors. And youth do report, even though it's hard to believe, that they look to their parents first for guidance on decision-making and problem solving around alcohol and other drug use. So they need us when they're young to really set the boundaries, give them good guidance, to really be their parents. And ideally, down the road when they're in their 20s and 30s, we can be more on a friendly basis as a friend or someone to hang with, but they need us as parents and when they're teenagers. Okay, that's probably it. If anybody has any questions, you can enter in chat. I wanted to just talk to you a little bit about the program that I work for through the University of Maryland Extension. These are some of the programs we offer. I'm sorry, this looks a little blurry on the screen, but mental health first aid and Botfin life skills are offered through Talbot County Public Schools. We offer those as well, but if you were interested in one of those programs, you should probably call the school system first and see if they could offer it. Is that accurate?
Yeah, we are still doing first aid trainings. We just we're not doing as many as we used to.
Okay.
Not sure if we're just doing staff,
Mhm.
or I think we are doing some outreach. So definitely look out for that in these next few months. It's just not going to be as many offered as we previously did last year. Botsfin Life Skills is not currently in the schools yet, but we do plan on that being part of that possibly here in the future, next couple of years.
And we offer it also through the ROPTA program, but I would maybe check with the school system first, and if there's not one going on, you could check with go on our website. I should have put that on there, but I didn't. But you can email me and I can give you that information. Overdose Lifeline are courses like this, but they are, and we've done some of those through this webinar format. The one that was, there's one called This Is Not About Drugs. There's one on the brain and the disease of addiction, which I think we did a few months ago. The opioid public health crisis. Generation RX, which is a medication safety program, and that we can do with young children, teens, adults, parents, and also senior citizens. It's on medication safety and using medications wisely and how to store and dispose. And then we also do a program called Regrounding Our Response, and this is kind of a more intense program, a little bit of more of a time commitment, but it gives you some in-depth knowledge on adverse childhood experiences or ACEs, drug user health framework. So if you're in the health field and you want to know how to treat patients that have some kind of a substance use disorder, that would help you. Also, the medication assisted treatment, stages of change and social determinants of health. So those really delve in a little bit deeper on how to help people, how to understand addiction and mental health challenges. So thank you for your time today. Hope this was helpful. I know it was a lot of information, and we appreciate you taking time out of your day to join us. And please contact us as you have questions or want to schedule another program.
Thank you, Beth. Does anybody, I know we're getting so like it's a little past 1 o'clock. Does anybody quickly have questions for Beth or myself? We put our emails in as well if you guys just want to email us. I know we're kind of probably cutting on, you know, some of yours if you're at work, your lunch hour possibly. Give you guys a few minutes to questions. There's also a Q&A up top if you want to do it in there, the chat, either one works. Just making sure. Let's see any open questions. Nobody's typing. Okay, well, if you guys think of any questions, feel free to email any one of us. You can call me here at the board office. But thank you everyone for taking time out of your day to come listen to us. I hope you guys, you know, learned a lot. And like I said, my name is Madison Elliott. I work for Talbot County Public Schools. I'm the substance use coordinator specialist here. If you have, you know, specific questions, concerns with, you know, your child and substance use, I'm the go-to person for that. But other than that, thank you guys, and I hope you have a great rest of your week and a good and safe Thanksgiving. I have to.
That was a full hour.
I think I'm still on. I'm still on.